Hello, my name is Christopher Ray. I'm an MSW student at Grand Canyon University. This is April 5th, 2026, and this project is for Dr. Alicia Jones. The LGBTQIA plus community is diverse and shaped by both systemic challenges and strong support systems, which are essential to resilience. That comes from NSAW 2021. The LGBTQIA plus community is a diverse population that includes individuals of varying sexual orientations, gender identities, and gender expressions. This population spans across all races, ages, and socioeconomic backgrounds. Despite this diversity, many individuals share similar experiences related to discrimination and barriers to care. At the same time, the community demonstrates strong cultural strengths, including chosen family systems and supportive community networks. These strengths play a critical role in promoting resilience and well-being. It comes from NSAW 2021. Resilience within this community is often rooted in chosen family and community networks, which help individuals navigate discrimination and marginalization. That's from NASW in 2021. Resilience within the LGBTQIA plus community is often rooted in connection and identity affirmation. Many individuals rely on chosen families, peer networks, and advocacy organizations for support, especially when biological family support is limited, if it even existent at all. These systems help individuals cope with stress, discrimination, and social exclusion from a social work perspective. Recognizing and building upon these strengths is essential for effective practice and aligns with strengths-based and culturally responsive approaches. That comes from the NASW 2021. These challenges reflect systemic barriers that limit access to services and opportunities, reinforcing the need for advocacy and policy intervention. That comes from Hoffer 2019. Despite these strengths, the LGBTQIA plus community continues to face significant challenges. These include discrimination in healthcare, housing, and employment, as well as barriers to accessing affirming mental health services. These issues are not just individual experiences, but reflect broader systemic barriers that limit access to resources and opportunities. Hofer, 2019, explains that these types of structural inequalities require advocacy at multiple levels to create meaningful change. The historical marginalization of LGBTQIA plus individuals demonstrates how policies and social attitudes have contributed to long-standing inequities that persist today. Hoffer, 2019. Historically, LGBTQIA plus individuals have experienced institutionalized discrimination, including criminalization, exclusion from legal protections, and social stigma. While progress has been made, these historical patterns continue to influence current systems and policies. This demonstrates that marginalization has evolved but has not yet been eliminated. Hofer, 2019, emphasizes that understanding historical context is essential for effective advocacy because it helps identify how systemic inequities persist over time. Evaluating policy requires examining both implementation and access to services, as policies may exist but still fail to meet the needs of vulnerable populations. That's from Hofer 2019 and NSAW 2021. When examining social policy, it is important to look beyond whether policies exist and evaluate how they are implemented and experienced. At the local level, non-discrimination ordinances may improve access to services. At the state level, protections vary widely, creating disparities depending on location. And federally, broader protections exist, but gaps in enforcement and access remain. This highlights that policy alone is not enough. Access and implementation must also be considered. Both Hoffer 2019 and NSAW 2021 emphasize that social workers must evaluate how policies impact real-world service delivery and client outcomes. Advocacy requires strategic planning and stakeholder engagement. It comes from Hoffer 2019. The advocacy plan for this project focused on legislative advocacy. The goal was to promote non-discrimination protections and improve access to affirming healthcare services. This plan included strategies such as coalition building, community engagement, and policy education. Hofer 2019 explains that effective advocacy requires strategic planning and collaboration among stakeholders to influence policy outcomes. This campaign reflects Hofer's 2019 emphasis on moving beyond awareness to action by encouraging engagement and policy involvement. The social media campaign used platforms, more specifically myself, was Facebook, but you could also use Instagram, TikTok, and X to raise awareness and encourage action. Two primary strategies were used: education and mobilization. Education helped inform the public about disparities, while mobilization encouraged individuals to take action, such as contacting legislators or sharing information. This approach reflects Hofer's 2019 emphasis on moving beyond awareness to action and advocacy efforts. Collecting community data aligns with social work's responsibility to assess needs and inform interventions. National Association of Social Work 2021, a 10-question survey was developed to assess community needs. The survey was distributed throughout social media, in personal networks, and was anonymous as well as voluntary. The questions focused on safety, healthcare access, mental health, housing stability, and perceptions of policy protections. The questions that were asked were the following: how safe do you feel expressing your identity in daily life? Have you experienced discrimination in any of the following areas, such as housing, education, healthcare services? How easy is it for you to access LGBTQIA+ affirming healthcare? Have you been able to access mental health support when needed? What barriers have you faced when seeking healthcare or mental health services? How stable is your current housing situation? What resources would most improve your well-being? Do you feel that current laws and policies adequately protect LGBTQIA+ individuals in your area? Collecting this data aligns with the social work responsibility to assess community needs and inform advocacy efforts. Nassau 2021. These findings highlight both strengths and ongoing gaps, reinforcing the importance of data-driven advocacy. Hofer 2019. The survey results revealed several important findings. All respondents reported feeling either they're safe or somewhat safe expressing their identity. However, 38% reported neutral access to affirming healthcare, and 38% reported difficulty accessing mental health services. While 92% reported stable housing, only 38% felt that current laws would protect the LGBTQIA+ individuals. These findings highlight that while some protective factors exist, systemic gaps and barriers remain. Identifying these needs is critical for developing targeted interventions and influencing policy change. Hofer, 2019. Based on the data, several key needs were identified. These include increased access to affirming healthcare, improved mental health services, and stronger policy protections. An important insight is that perceived safety does not eliminate systemic barriers. Even when individuals feel safe, structural inequities can still limit access to resources and opportunities. Hofer, 2019, emphasizes that identifying these gaps is critical for effective advocacy and policy change. Hofer, 2019, emphasizes that advocacy must be continuously evaluated to ensure effectiveness and responsiveness to community needs. Evaluating advocacy efforts is an ongoing process. Key areas of monitoring include policy implementation, access to services, and community feedback. This can be done by reviewing legislative updates, collecting survey data, and tracking engagement in advocacy efforts. Hofer, 2019, emphasizes that advocacy must be continuously evaluated to determine effectiveness and guide necessary adjustments. Ethical practice requires responsiveness to barriers and ongoing reflection to improve advocacy efforts. Nassau, 2021. Several lessons were learned throughout this process. One key lesson was that the importance of building trust and using inclusive language when working with vulnerable populations. Barriers included a limited sample size, potential response bias, and the sensitive nature of the topic, which may have impacted participation. These challenges highlight the importance of ongoing engagement and diverse outreach. Both Hofer and Nassau emphasize the need for ethical, responsive, and inclusive advocacy practices. In conclusion, this project demonstrates that effective advocacy requires more than awareness. It requires intentional action and ongoing evaluation and collaboration. Social workers play a critical role in bridging the gap between policy and lived experience. As emphasized by Nassau, advocacy is an ethical responsibility of the profession. Advocacy is not optional. It is essential to promoting equity and improving outcomes for vulnerable populations. Social workers have an ethical responsibility to advocate for vulnerable populations and promote social justice through policy and practice. Thank you for your time.